We have chosen to talk about how to do a bandage because it's an important process. It avoids the patient to see the wound, and it protects the wound of bacteria. We learned this process in our courses of nursing because it's really present in our environment. The first step is the preparation of the patient. Before to go into the room, we must wash our hands. After, come into the room and present your identity to the patient. Hi, my name is Patricia and I study in nursing. I will pass the day with you. Check the bracelet of the patient to see if it's the right. And it's the right. The step 2 is the material preparation. But before to do the material preparation, we must be sure that the patient is in comfortable position to stay like this during the bandage. Are you comfortable, Mrs. Roy? Yes, good. We can start the material preparation. We must have sterile solution, Ipafix to fix the bandage, sterile field, gauze, another sterile field, the appropriate cream to the wound, sterile gloves, and abdominal pad. We must have sterile container, scissor, and other sterile instruments.
Step 3 is to examine the wound before changing the dressing. Before examining the wound, it is important to gather the material you will need to change the dressing. It will be necessary to manage a sterile field to make sure that there is not contamination with bacteria. In order not to contaminate the area, there are some precautions to be taken. Keep your eyes on the sterile feed, keep it above the waist, and do not move your arms above it. When the sterile feed is ready, it is time to care of the wound. You put your gloves to examination. So you go see your patient. And you look at the wound. To examine the wound, it is important to wear clean gloves. There are 4 important points to be observed regarding the discharge of the wound: quantity, smell, color, and consistency of flow. If a drain is inserted to allow drainage or keep the lips closed, the nurse should be observe if the drain is securely in place in the wound. At that point, the nurse is ready to start the disinfection procedure.
Okay, so now the step 4 is the disinfection. First, you need to open the sterile field. After this, you need to open the sterile container. After, you put the saline solution into the container, and it's important to verify the date and the expiration date of the saline solution. So, Okay, after this, you need to put the sterile gauze into the saline solution. It's important that the gauze are fully of the saline solution, like this. After, you need to dry them a little bit because there's too much of the saline solution. Perfect. Now we can go to the wand to disinfect it. Okay, so now you need to disinfect the wand. Disinfect the area from the least contaminated region to the most contaminated region, like this. Normally you should use a different buffer for each step, but because we don't have infinite gauze, we will only use one. So after, you need to take a gauze and dry the wand, like this. This will reduce the excess of moisture that could eventually host microorganisms.
The step 5 is to remake the bandage. So once the cream is applied, we take some sterile gas and we put it on the wound to stabilize it. If the cream has overflown like this, we take another sterile gas and we wipe out the overflow. After, we take a abdominal pad to stabilize out the sterile gas on the wound, and we tape it with diethylene. After all the step is done, we can remove our gloves and drop it in the garbage. After the removing of the glove, you pick up all your material and we stuck it where it should be. The bandage is a big part of this operation, but the note in the folder is very important too. It is almost as much important as the making of the bandage. Why? Because if it's another nurse who take care about this patient, he will know all the information about the wound and how to do the bandage.
The next time that your friend is hurt, make sure that you have the 5 steps correctly. The first step is to make sure that your friend is comfortable. The second step is to be prepared. The third step is to change the bandage. And the fourth step is to protect, it's to disinfect the wound. And the last step is to make sure that, to change the bandage.
Thanks for listening!